Happy National Volunteer Week, everybody. Hope you're having a great week and you're not too exhausted with all your parties and morning teas and celebrations. And also thank you, Michelle, for making me feel really awkward about how long and boring my speech is going to be. So I'm the volunteering manager for Uniting Care Queensland, and within Uniting Care Queensland we manage, or part of our programs are Blue Care, Lifeline, Child and Family, including out-of-home care and family intervention services, childcare services. What else? Hospitals. We have 4 hospitals that we oversee. So the Wesley Hospital in Brisbane, St Andrews Hospital, Sunshine Coast Private Hospital, and Hervey Bay St Stephen's Hospital, the first fully digital hospital in Australia, and disabilities. So we've got this massive organisation. Our organisation has 16,000 employees and we involve 9,403 volunteers.
That's where they all are.
Yeah, sorry. It's a lot of people who want to be involved in our organisation, and a lot of the work that we do is super critical to the functioning of our communities. And like many community service organisations who were started by volunteers, volunteers still play an integral role in the way that we operate. I guess what's happened over time is I'm going to talk a little bit today about how we move from having volunteers are over there and we have them, to involving volunteers. So actually volunteers are critical and central to the way that our organisation operates. I guess over time our organisation, because it was started by volunteers, and volunteers in fact ended up raising the money to employ the first employees that our organisations had. So often they were small church groups, community organisations, just people who were concerned about families or people in their local community who saw a need and responded to it. I don't know what it was about Australian society between the 1930s and the 1970s, but they were incredibly motivated, probably similarly to the millennials now. They saw a problem and they wanted to do something about it, and they did it the way that the culture said they should do it back then, which is let's form a committee and an auxiliary and let's get people together and let's deal with this issue. Millennials do it a little bit differently now, but they're still actually doing it, and it's really sort of a key to our culture. And while sometimes we can feel a little bit depressed about how sometimes Australians can behave in some spaces, I think we can be really proud that we are a volunteering nation and we are a nation that are helpers. So that's at the core of pretty much what everyone who manages, does and looks after. So of our volunteers, about 5,700 are ongoing, operational, critical to the services that we provide every day volunteers. About 3,500 of them are that episodic or event volunteer. They dip in, dip out. We reach out when we need something done and they tend to respond. So they're serial episodic people that we register and manage the same way that we manage our other volunteers. Each month they donate around 130,000 hours. That's equivalent wages when we look at time for time. A significant contribution, $3.5 million, and that's just time for time. That doesn't actually take into effect all the other benefits of volunteering and all the other value that volunteers actually contribute to our organisation. And in terms of diversity, in terms of representing the broader community, we've got 9% of our volunteers identify as being from a culturally diverse background, 3% people with disabilities, and 2% Torres Strait Islanders, and that's if they choose to tell us. Obviously it's your choice. Some people don't choose to tell you that sort of information, but still it's an interesting fact, especially considering that around 60% of our clients in some of our programs are Indigenous or from culturally diverse backgrounds. So how representative is our volunteer workforce of the people that we're serving? Just some quick profile. I know it's a bit boring, I'm sorry, and I'm trying to be quick.
No, don't make me feel
just when we're talking about the generational stuff, about a quarter of our workforce is under 30. So about a quarter of our workforce is millennial. And about a quarter of our workforce is over 65. So they're the pre-boomers. And what we found, and this is the following slide, so I'll zip through that one really quickly, but what we found is that we are offsetting the decline in our pre-boomers with the millennial volunteer, but the millennial volunteer is episodic. They're dipping in, dipping out. They're not sticking around. So therefore they're not necessarily delivering that critical service that the pre-boomers are delivering. So when it comes to our Lifeline service, crisis line, we have a lot of millennials on that, but they're not going to stick around. We know that. They're going to dip in, make an impact, get the training, help the people while it's interesting, fun and inspiring, but they're not going to be doing it in 5 years' time, and we know that. Whereas the pre-boomers have been doing it for 30 years and they'll do it until we say you can't do it anymore, or they're not able to do it anymore. Our smallest group of volunteers is actually the Generation X, which the Bureau of Statistics says they're the largest group that volunteers, particularly in the community and health services space. So across the sector, that group apparently is helping in our space, but we're not attracting them, so we don't know why. I think they're lying on the census myself. Yeah, schools, exactly, and that may identify that with social and health services. Yeah, absolutely. But our largest group of volunteers is the baby boomer. So thank you, baby boomers, because you are actually equally spreading your time between that episodic space and the ongoing space. So we're really dependent on baby boomers now. So like many organisations in our sector, pretty much 75% women, 25% men, and we definitely need more male representation. We know that in suicide rates in Australia, men are most at risk of suicide and men are most at risk of not talking about it, and we have a need to be able to attract more men to that service, volunteering. So again, the service represents the community it's supporting, so people feel comfortable using that service and reaching out. So there's some challenges for us into the future. Why people have joined us in 2017, so I just did a quick snapshot from some of our data that we collect, and 27% that they want to make friends, 22% said they want to upskill, gain new skills, change careers, 51% are job seekers, which is reasonably new, and I don't know, it's probably been a new push on work for the dole or something, and people are actively seeing that pathway space, and that's just this year, so it's a couple of months data. So among our Blue Care people, we recently interviewed them and surveyed them, a very broad survey, just to see where we stand, how they're finding their experience, and find out how satisfied they are. Our Blue Care people are particularly in that older age group of volunteers, but they are critical. So they are actually improving lives of people in community care, in residential care, people who have in aged care, but also people with disabilities, younger people with disabilities, also drug and alcohol services. It's a massive organisation that definitely relies on volunteers, so we really need to make sure that we're servicing them well and involving them and making sure that they're contributing as best as they can and that we're a good place for them to volunteer. So we asked them what their expectations were. It was free text, so it was a little bit of work to try and work out some key themes that came out of the survey, but 15%, bottom line, they just wanted to be treated respectfully, which we interpret as you want to be involved, you don't want to be on the side. You don't want to be doing the stuff that staff don't want to be doing. You actually want to be integral to the service and a key person helping to make lives better for people. 12% said they wanted more support, training and information, which again we take as you need more information to do the work that we need you to do. So people are presenting with more and more complex needs in our services, and in particular Blue Care. Are we making sure that volunteers' training and skills and support are up to date with the complex needs of those people that we support? And 10% said adequate recognition. Some people gave us examples of what that is, and nobody said certificates or badges. So we need to unpack more what that looks like, and actually how do we recognise people in the way that they feel like actually it's genuine, it's real, and it's from the heart. So, and there's lots of stuff there, and feel free to read. I'm not going to read through it all. So then we asked volunteers, what do you recommend would make volunteering better for you? 26% said we need more volunteers, like they're overworked. We actually have a huge expectation on our volunteers, and they can see that there's a gap, and that the trends, the challenges that are facing volunteering across the globe, but Sunshine Coast, Brisbane, Queensland, definitely, we are losing people who are our stalwart volunteers, and we can't replace them. So that's becoming a key challenge for us as an organisation. They also, again, recommend more relevant training. And Interestingly, 12% said improved organisational governance and 12% said remove administrative requirements, which I think are actually, that's 24% of people said paperwork sucks and that we give them, there's too much red tape. And we know that. And so that for us, we really have to work out, well, how do we keep the organisation safe? How do we keep volunteers safe? How do we manage risk and still give people the freedom and flexibility to be able to support the people that we serve the most effective way possible? So bureaucracy is a big problem. And I think anyone who works as a volunteer manager will know volunteers don't want to sign up and be treated like an employee, but they want the same respect and ability to impact changes as employees. So how do we need to find a better solution in that space? And I know the national standards will help us with that, so thank you, Volunteering Australia and Queensland. This one, I just want to mention a couple of points around this. This is the reasons volunteers join Blue Care. Mostly results were pretty consistent, but when we then divided the results into, well, what do over 50s say and what do under 50s say so that we can reach out to those millennials, is they both agree that desire to help and make a difference was why they joined, and they both agree that giving back to the community was key to them joining. But interestingly, about 50% of millennials, or not millennials, but under 50s, said that they wanted to gain skills and experience. That was really important to them, and that didn't feature at all with the over 50s. The over 50s said having a purpose and building relationships. So I think another interesting point is that with the under 50s, they also want to build relationships. And when we find out why people joined our organisation, one of the key reasons, no matter what age group, was that they knew someone who was already there, or someone told them it was a good idea. And that was really striking in the millennial group. Because I thought that if it was sexy on Facebook, we'll get the young people. We'll get an app. That'll get the young people. Actually, they don't care about that. And they've actually told us in focus groups, don't build an app because I'm not going to download it. I have 6 apps and they're the ones I use, and that's that. So don't look at technology as the answer around engaging us for your organisation. Maybe different for others, but for our organisation and the types of work we do, that's not important to them. What's important to them is that they like us, they can build friendships, and that someone told them that we were good people, which was exactly the same as the pre-boomers. So again, our challenges, the generational stuff. What are we going to do about backfilling those critical volunteering roles, and do we just have to start paying people and employing more people and forget that volunteers can contribute in that space? What are we going to do about the market changes? Our organisation has always relied on block funding in the recent years, block funding in order to provide the services. Blue Care, for example, the money's come to Blue Care, not to the person needing the support. So we were always assured of an income and always assured that we could finance volunteering, because as we all know, volunteering is not free. It's not free for the volunteer and it's not free for the organisation. So how are we going to deal with the fact that the client's going to receive the money, not the organisation? How do we then build in and still maintain volunteering in an organisation? And that's true for disability services as well, around the NDIS. And how are we going to get our volunteers to reflect the community that we support? Because if we truly want to involve volunteers, then they have to be the people that we're supporting that are represented in our volunteer space. I'm not going to go through that because I'm trying to be really quick, but just know why you need to have volunteers, plan for volunteers, make it integral and part of your organisation's future. Volunteers aren't to the side, they're part of your organisation. Have simple tools, recognise in the way that means something to the volunteer, and report and measure the impact. We report and measure dollars time for time. 20 hours, that means that's $400. That actually doesn't come anywhere near explaining to an organisation what that resource is all about and what it's contributing to your people and your community. Finding a way that we can measure volunteering contributions is key to organisations understanding just how important this resource is. So there's a lot of work going on, I know, in universities, and lots of organisations are grappling with this, but we need to find a number because unfortunately everybody's got an MBA and everybody's got an accountancy degree and everybody only sees dollars on the page, and that's how we understand whether something has a value these days. Fortunately, 97% of our volunteers are super satisfied with the organisation and they would recommend volunteering more broadly. 94% of our volunteers would recommend our services to people who are looking for services like us, which means that we can actually, it's the best marketing tool you could ever imagine. And that would be the same for all of your organisations. Your volunteers are your biggest promoters, but they can also be your biggest attractors. So if you are not managing volunteering very well, or volunteers continue to remain to the side of your organisation, you're probably not going to get as good advocacy as what you get with volunteers who are absolutely involved in aspects of your organisation. And then you get that beautiful impact, beautiful slide, and everybody's happy. Thank you.